Hello, I'm Dr. Paul Harrison and I'm the Acting Chief Executive for the Trust, and welcome to my first Chief Executive's briefing. This will provide you with an update of the work we are doing to offer safe, high quality care and how we are using your feedback to make changes to improve our patient experience. Each video throws a spotlight on a different department to give you an exclusive look behind the scenes. This time we are visiting our pharmacy department, but more about that later. I would like to say thank you to Paula Clark for her professional leadership of the Trust over the past 7 years, which has helped Dudley become one of the top performers in the country and one of the best places to work. We wish Paula all the best in her new venture. We are currently out to recruit the permanent Chief Executive, and we will keep you all posted of our progress in this area. I would like to also welcome Dr. Matt Banks to the Trust Board as Acting Medical Director whilst I'm acting up as Chief Executive. As you know, the NHS has a set of standards that aim to help us provide the best patient care within given timelines. We are pleased that our overall performance against key standards continues to be very good. We should make sure that at least 92% of patients waiting for a planned appointment are seen within 18 weeks from referral by their GP. We continue to exceed this, and at the end of September, of the 16,557 patients this standard applied to, we are pleased that 96.13% were not waiting longer than 18 weeks. We aim to see, treat, admit or discharge over 95% of emergency patients within 4 hours of their arrival at A&E. We continue to be one of the few trusts to meet this standard, and from July to September this year, of the 43,000 emergency patients that came to Russell's Hall, 95.7% were seen within 4 hours. We should ensure all patients with cancer are treated within 62 days from urgent referral by their GP. The national standard is 85%, and I'm pleased to say that we have achieved this for the most recent nationally reported period, April to July, with 87.8% of patients receiving treatment within the given time frame. We continue to have increased demand for our services, and I would like to take this opportunity to thank all our fantastic staff who are working very hard in these challenging times to provide our patients with safe, quality care. Our staff continue to go that extra mile. This year is a very challenging one financially. We have to find £11.9 million to get back into balance. This is proving difficult as we've been making efficiency savings for many years now, and we pride ourselves on being an efficient organisation. Since April, we have seen an unprecedented number of patients who are ready to leave hospital, but whose onward journey has been delayed. This prevents us from getting patients flowing through our system and to the right bed at the right time. We are working with partners across Dudley and surrounding areas to try to address this issue. Every region in the country is preparing a plan which looks at making the health and care system fit for the future. This will help to make sure we are all learning from best practice and sharing knowledge across the country. This is to help bring the whole financial system back into balance next year. There are 18 partner health and care organisations across the Black Country who have developed our sustainability and transformation plan. Regional plans are being published over the winter. In Dudley, we have already done a lot of work to consult the public on our plans, including the development of the multi-specialty community provider. This will bring together primary care provided by GPs with other community and voluntary services. We are doing all we can to make sure we have the best health and care service for the future. We aim to provide the highest quality care to patients, and protecting them from infection is one of our quality priorities. We are proud that we have no cases of MRSA for over 12 months since September 2015. From April to September this year, we have seen 21 cases of Clostridium difficile, or C. diff as we refer to it, 8 of which have been reviewed, of which 4 are apportioned to the Trust. To give you a comparison, last year we had a total of 43 cases of C. diff, of which 20 were apportioned to the Trust. There continues to be a national shortage of many healthcare professionals in the NHS, with shortages of nurses, doctors, therapy and scientific staff a particular concern. Dudley is no exception, and we continue to hold recruitment drives to fill vacant posts for nurses, midwives and clinical support workers. Anyone interested in working for us should keep an eye on the NHS Jobs website or the Dudley Group Facebook page. We're an award-winning trust amongst the best in the country for our performance. So if you are looking for a career in healthcare, please get in contact with us. It is really important to continue improving our services based on what our patients are saying. One of the best ways patients can help us is by filling out a friends and family card whenever they use our services. Inpatients can find one in their welcome booklet. We are thrilled that during August, 100% of our new mums, 97% of inpatients and 96% of community patients would recommend the Trust as a place to receive care or treatment. We have worked hard to improve our patients' experiences of our outpatient department. In August, 92% of patients would recommend our outpatients to friends and family, which is a 10% increase since May. Nominations for our Staff Committee to Excellence Awards are now open. If you know individuals or teams who go the extra mile and you think they deserve to be recognised for their efforts, please nominate them for an award. Patients can enter a nomination in the category of Excellent in Patient Care. Staff can nominate colleagues in any of the 5 categories. Use the online form available from the front page of the website or complete a paper nomination form which are available throughout the Trust. A tip from me: if you want to see your nominee shortlisted, give as much detail as possible about how they met the criteria in your chosen category. Winners will be announced at an awards ceremony hosted by television newsreader Nicholas Owen on the 16th of March 2017. Even a mild flu season can contribute to more than 2,000 deaths across the country, the majority of which could be prevented if these individuals have been vaccinated against the seasonal flu virus. Staff can get their flu vaccine free of charge, and certain groups of patients can too, so check with your GP. We're encouraging everyone who has a vaccine to take a flu fighter selfie to share on social media. If you use Facebook, you can either tag us in your photo or post the picture to our wall. You can find us on Facebook by searching for the Dudley Group NHS Foundation Trust. If Twitter's your thing, post your photo and tag @Dudley Group NHS. And don't forget to use the hashtag #FluFighter. If you're not social media savvy and you still want to get involved, ask a friend or colleague to post for you. As you can probably tell, I'm standing in our busy pharmacy department, and I promised you earlier a spotlight feature. So now I'm going to hand you over to Rookie Colon, our Associate Director for Pharmacy.
The vast majority of our patients will be prescribed medication at some point during their care. It's vital that we ensure our patients receive the right medicine at the right dose and at the right time. In the average general hospital, 97% of our patients will be taking a medicine. They may be admitted with this medicine, they may be prescribed with a long-term condition such as asthma or diabetes. And we know that medicines account for 5% of the total NHS expenditure, which is approximately £11 billion per annum. At the Dudley Group, in 2015 and 16, we spent just over £33 million on medicines. Our pharmacy staff dispense more than 500,000 items in a year. Break this down by month, this includes almost 1,000 chemotherapy prescriptions, 7,000 outpatient medicines, and in a month we process around 16,000 medicines for patients to take home as part of their discharge process. We call these TTO medicines, and the average waiting time for TTOs is about 90 minutes. Unfortunately, there will be sometimes a delay in processing a TTO. For example, if an emergency or an acutely ill patient arrives on the ward and has an urgent need. Pharmacists play a key role in advising prescribers on the selection of medicines and potential side effects, as well as ensuring patients receive the correct dose and the way of taking it. For example, tablets, injections, ointments and inhalers, all of these can be complex. Safety is our #1 priority, and we have robust systems for checking that medication is dispensed according to the prescriber's requirements and according to the prescription. This is a complex process, and inevitably there will be sometimes a delay for patients receiving their medicines. Technology plays a big part in buying, managing and dispensing medicines. Our automated pharmacy, known as the resident robot, packs, picks and maintains a large proportion of the drug stock. Drugs delivered to the hospital are tipped into a giant hopper, and a conveyor belt moves them along to the machine which reads the barcodes. Robots then stack them onto the shelves. All of this leads to more accurate stock control and has shaved thousands off the pharmacy drugs bill. All work received into the pharmacy is booked onto the pharmacy tracker system. As the work is progressed through the department, the tracker is updated. Each ward can access this tracker system via the Trust intranet and are able to monitor the progress of the patient's prescription. They can see when medication has left pharmacy and is on its way to the ward. Chemotherapy treatments are prepared in a sterile environment called the aseptic suite. It's sterile to protect the patients receiving chemotherapy and the staff preparing the drugs. They're prepared in a mini clean room called an isolator by technicians wearing personal protective equipment. Clean air is pumped into the aseptic suite through a series of filters, and the flow is tightly controlled to protect the drugs from contamination. Chemotherapy drugs can take up to 2 hours to prepare and are expensive and have limited shelf life, so are made on the day of treatment. We ask patients to come to the nurse-led oncology day case unit the day before planned chemotherapy treatment, so that the oncology pharmacist can monitor patients' blood profiles with the specialist nurses. We then can assess if the patients are well enough for their treatment. If the blood counts are too low, patients are reassessed and the treatment may be reduced, deferred or referred to a doctor. Pharmacists and pharmacy technicians carry out daily rounds to check the medicines prescribed on the inpatient drug charts and liaise closely with our GP surgeries and pharmacies local to the patients. The pharmacy team work at ward level using mobile laptops called computers on wheels, and this allows them to check patients' dispensing records, dispense urgent medicines, assess patients' own medicines and dispense some discharge medication in preparation for patients who are being discharged. The pharmacy team is on hand to talk to patients about the correct use of their medication. We also review the use of antibiotics to make sure they are correctly used to prevent bacteria such as Clostridium difficile from becoming resistant to antibiotics. Some pharmacists specialise as consultants or as pharmacists with specialist interests in areas such as respiratory medicine, oncology, cardiology, urology and diabetes. Most patients receive their medicines through a prescription traditionally written by a doctor. Changes in legislation mean that nurses, pharmacists, podiatrists, physiotherapists, radiographers and optometrists can also become qualified prescribers. Some of our pharmacists have undertaken advanced training to become independent prescribers. This permits them to diagnose conditions within their area of expertise and prescribe medicines accordingly. At the Trust we have pharmacists working in respiratory, elderly care, oncology, surgery and stroke. This supports our doctors to spend more time on more complicated cases. The pharmacy profession can be traced as far back as the Sumerian population living in modern-day Iraq. From around 4000 BC, they used medicinal plants such as licorice, mustard, myrrh and opium. The role of the doctor and pharmacist started as a single one, but later separated into specialists who work to prepare medicines, our pharmacists, and those who specialise to diagnose and treat sick people, our doctors. Roles that we see today.
I hope you enjoyed our behind-the-scenes focus on pharmacy. If there's an area of the Trust you would like to see in the next quarterly update, email your suggestion to communications@dgh.nhs.uk. Thanks very much for watching.